So the vital signs and the blood loss. What are the changes that will happen to the vital signs when there is a blood loss? Well, first of all, let's talk what are the vital signs that we always look for in any patient who comes with a blood loss. So we have 4: heart rate, respiratory rate, blood pressure, and urine output. And regarding the blood loss, we have 4 classes. So class 1, if there is a bleeding of less than 750 ml, class 2 750 to 1500, class 3 this number between this range, and class 4 is more than 2000. Now unfortunately in exam they might ask about the percentage of the blood loss. So in class 1 it's less than 15%, class 2, class 3 and class 4. I know it's annoying, but this is something we need to learn. Okay, so for the class 1, what are the vital signs changes that we will see? So imagine for class 1 you are going to donate blood. So after you donate blood, which is usually 500, you don't feel anything. So in class 1 there are no changes at all. So there no change to the heart rate, respiratory rate, blood pressure or urine output. In class 2, 750 to 1500 ml blood loss, you will start feeling some changes of the vital signs. And the more blood loss you would have, then the more changes you will see in the vital signs. So the changes start from class 2 and then increase in class 3 and increase even more in class 4. And let's study them all together, and that would make our life easier. So we said in class 1 there are no changes, so let's just cross that. In class 2, 3 and 4. To start with the heart rate. With the heart rate I want you to remember the number 20. And for the respiratory rate and the urine output, I want you to remember the number 10. So the normal heart rate is between 60 and 100, and in a bleeding the heart is trying to beat fast to pump blood throughout the body. So in class 2 we add 20, so the normal is 60 to 100, so we will start from 100 and add 20. So class 2 is between 100 and 120, and then class 3 we add another 20, so 120 up to 140, and in class 4 it's over 140. Respiratory rate and urine output, we remember the number 10. So in the respiratory rate, the normal respiratory rate is between 12 and 20, and we will take this number and add 10 to it. So in class 2 it will be between 20 and 30. Class 3 we add another 10, 30 and 40 and more than 40. And the urine output, the normal is 30 ml per hour, so we add 20. Sorry, we reduce 20 because the kidney will try to save fluid and not making urine, as there is a fluid loss. So the kidney is trying to retain fluid inside the body to make up for the loss of blood. So the urine output will decrease, and we remember the number 10. So normal is 30 ml per hour, so we reduce 10, so it will be class 2 20 to 30, and class 3 we reduce another 10 to 20, and class 4 it's less than 10 ml per hour. Okay, so regarding the blood pressure, there is mild decrease in blood pressure, and there is moderate in here, hypotension, and there is usually severe hypotension in class 4. Just on a side note, for the blood pressure for a class 2 it's very mild, that it's barely noticeable. So sometimes in books they say it's even normal. However, it will definitely be decreased in class 3 and class 4.